So the symptoms of Lyme disease, I'm going to kind of break it down into acute and chronic. The reality is that there's a tremendous amount of overlap. It's not as simple as I'm putting it, but for practical purposes, I think it kind of helps you gel in your mind, what to be looking for. So classic Lyme disease, if you read a medical textbook, this is what I personally experienced. I had classic Lyme disease. And by the way, out of the thousands of people that I've treated with Lyme, I'm one of the few people who's actually had classic Lyme disease. So it's not as common actually as you might think. So headache, stiff neck, high fever, and usually it's a high fever. I apologize, and I'm American, so I'm going to say 104, 105 degrees Fahrenheit. I have no idea what that is in Celsius, but it's high. Arthritis, often you'll get swollen joints. Spine pain, especially low back pain. This is very classic for Lyme. People who aren't typically prone to getting back pain will complain their low back hurts. When I had it, I thought I had a broken back. I was ready to go get an x-ray. It was that painful. And of course, the classic bullseye rash. If you see this, do not pass go, do not collect $200. It's Lyme disease. You don't even need a test. There's nothing else out there that causes this classic erythema migrans or bullseye rash. Debilitating fatigue, chills, swollen lymph nodes, heart palpitations, shortness of breath, memory loss, and Bell's palsy. All these kind of things can be associated with acute Lyme. Now, is someone going to have all of these symptoms? No, not usually. But you'll hear about these things that are, they came on very quickly. Usually people with acute Lyme disease, they are and look acutely ill. They're sick. And it often gets confused for meningitis. There's a lot of characteristics between whether it's bacterial or viral meningitis that looks a lot like Lyme, particularly that head pain, that neck stiffness, the back pain. You're going to think, wow, something's gotten the meninges, something's in there that's causing this inflammation. I actually had meningitis when I was in college, so when I had Lyme, I'm like, oh my God, I got meningitis again. I was actually on my way to go to the hospital, and as I was getting ready to leave, my ex-wife says, oh, what's that on the back of your leg? And I did the double mirror thing, and there's a huge bullseye. Well, it's on the back of my leg. I couldn't see it. I had no idea it was there. So I'm like, well, we can skip the hospital. I know what it is now. And, 4 days of doxycycline, I was good as rain. Good as rain. That's good as gold. And I took the antibiotics. I felt great for 4 days. And then 8 months later, I started to relapse. And we'll talk more about why that happens in a little bit. So think about, anyone who might be suspicious of meningitis. Now, send them to the hospital anyway because you don't want to miss meningitis. But if they get ruled out for meningitis and they're still having these kind of symptoms, you need to be thinking about Lyme. So you've all seen this rash. This is the classic rash, that target or bullseye rash. However, there are variants of this rash that don't look like this. So when you see sometimes just a generalized erythematous rash, the one thing about these rashes that are a little bit different than other types of, like compared with eczema, well, eczema is going to be itchy, eczema is going to be flaky. You're not going to get any of that with an erythema migrans. Most of the, you're not going to feel a tick bite, so it's not like a mosquito bite or a sand flea or a fire ant that you're going to feel it. So you're not going to feel the bite. You're not going to know it's there. And these ticks like to go to the warm, moist areas of the body. So the common areas you find this are armpit, behind the knee, sometimes in the scalp. I actually had one patient that we were sure they had Lyme. We didn't have any, we couldn't see any skin rash, but the mom had noticed, this was a child, she saw something kind of at the back of the neck. So they actually ended up shaving this child's head, and you could see the big bullseye on their scalp. But you couldn't really see it because of their hair. But I've seen variations where it's just general erythema. Sometimes it's not a nice perfect circle. It's more oblong. So if you see any rash again that kind of comes on and it keeps spreading, again you might want to think in the back of your eye that could be Lyme. So again, this is the rash that we always talk about, but the reality is that you're going to see other variations of skin rashes that don't look like this. Acute symptoms can occur really anywhere from 3 to 30 days following a tick bite. The CDC says that 70% of the people who get Lyme get this erythema migran rash. Most of the experts out there will say, and even some of the research suggests it's actually less than 40%. In my patient population, it's less than 25%. So it is not a common marker that someone's had Lyme. But again, if you do see that rash, it's pathognomonic for Lyme. I said you already know what's going on and you can start treatment right away. Most people who get bit by a tick have no idea they got exposed. This is going to be probably the most common thing that comes into your practice. It's not going to be the acute Lyme patient. More than likely, if they have acute Lyme, they're going to end up in an urgent care center or hospital. However, you're going to see the people who've had these ongoing chronic nagging symptoms. They've been to the endocrinologist, the rheumatologist, the internist, everybody, and nobody can figure out what's going on. But they've got this collection of chronic symptoms that keeps getting worse. And because they have these vague symptoms, they're going to go through a lot of workups. These will be the patients that walk in with a stack of paper this thick of all the labs they've had done, imaging studies that are all negative, and you're going to be the genius who figures it out. Autoimmune diseases also look a lot like Lyme. So one of your rule outs, and we'll talk about lab testing, is you got to rule out all the other autoimmune diseases. Because of that overlap in symptoms, you need to rule out lupus and rheumatoid arthritis and Reiter's syndrome and all these other things, which is not difficult to do. But because of that overlap in symptoms, you do want to be able to distinguish if it truly is autoimmune in nature. So chronic Lyme disease, you're going to see a lot of the same symptoms as in acute Lyme. Some of the things I think I'll mention that are a little bit different, you might get more GI or abdominal problems. Memory loss and cognitive impairment, what we call brain fog, is a very common complaint in chronic Lyme patients. Neuropathy starts to become more prevalent. Now, I had neuropathy when I had acute Lyme, but I see it in people that develop it as it gets into a chronic stage. And often it starts to get worse. Sensory distortion. What I mean by sensory distortion is particularly what people will describe as a burning sensation. They always feel like they have a second-degree sunburn, and you look at their skin, it looks perfectly normal. There isn't anything actually topically on the skin that's causing the problem. This is a neurological sensation that's part of that neuropathy syndrome, but they'll describe that burning sensation, and it's a bit maddening. It's mostly going to be in the hands and the feet, but I've had patients describe it on their face, on their back, on their abdomen. So just be aware that you could see it anywhere. The other thing that's also very classic specifically for Lyme is what we call wandering symptoms. So one day it's my right shoulder, the next day it's my left knee, the next day it's my right ankle. There is nothing else out there that I know of or that's ever been in the research that causes wandering symptoms. Because if you have a legitimate autoimmune disease, it's the same problem over and over. My right hip hurts every day. You don't see that change in symptomology. So when you start hearing about things wandering or moving around, that should be a big red flag that it's probably Lyme. Light and sound sensitivity, all of a sudden people become very photophobic and sound sensitive. Dizziness, vertigo. A lot of people start complaining of sort of recent onset sleep disturbances, just general rheumatism, aches and pains. You can get cardiac problems, mitral valve prolapse, bundle branch block is very common. There is a thing called Lyme carditis. So a lot of times people with Lyme can get secondary heart complications, in which case you want to get them off to the cardiologist for evaluation. What I call newly acquired dyslexia. And I experienced this myself. All of a sudden I started transposing letters, like someone with dyslexia would do. And I've never had that my entire life. And I've heard this now with other people. And whether they're writing or even typing, you'll see, they'll talk about this. Yeah, I just keep mixing up words, mixing up letters. And it just started. I don't know why. It's kind of weird. Another odd Lyme symptom. Balance problems, coordination issues. People say I'm clumsy, I trip a lot. If they start getting, central nervous system involvement, it'll look a lot like MS. And therefore you'll get MS-like symptoms with foot drop and these type of things. And you'll get a lot of endocrine disruption, particularly thyroid problems. Hypothyroidism following Lyme is extremely common. So if you've already made that diagnosis of Lyme, part of your workup is start looking at the endocrine system and measuring these hormone levels, because often you'll find many of them develop Hashimoto's, specifically autoimmune thyroiditis. As I mentioned, Lyme is the great imitator. It looks like a lot of things. When I originally did this, I had a slide of everything I could find that was related or confused with Lyme, and I think it was 14 slides. So I consolidated it down to one. Autism, MS. In my world, MS is Lyme until proven otherwise. And if you look at an MRI, the lesions on MS and the lesions of Lyme are identical. If you sit down with a radiologist and ask them, can you tell the difference? They'll tell you no. The one distinguishing factor on an MRI, though, that's a little bit different in other forms of MS that aren't Lyme-related, there's a different on the T2-weighted MRI. The way the lesions light up look a little bit different. That's pretty much it. And depending on where someone is in the process, again, it's very difficult to distinguish. And I find when someone comes into my clinic diagnosed with MS, we always test them, and if they test positive and we treat them for Lyme, amazingly their MS symptoms get better. So And I'll say not just MS, but even really any other type of chronic neurological problem, whether it's Alzheimer's, Parkinson's, and so forth. There's a great story. One of my colleagues, and his story is public, so no privacy violations, but he was an oncologist, and he was diagnosed with Lou Gehrig's disease. He was in hospice, he had just a few months to live, and one of his colleagues had said, hey, were you ever tested for Lyme? No, I've never been tested for Lyme. I live in Colorado, there's no Lyme here. So he was convinced to go ahead and say, you know what, just try some IV antibiotics. You got nothing to lose, you've got just a few months to live, and sure enough, he starts IV antibiotics, and he starts feeling better. And he had 6 Lyme tests, 5 of which were completely negative, and the 6th one lit up like a Christmas tree. And after a month of IV antibiotics, he got out of hospice. He's now back working full-time as a doctor treating Lyme patients. So I think his story was a great example of how Lyme can affect the brain and mimic a lot of these other things. And I always find it interesting, and you may have had this experience with other healthcare professionals, sort of the lack of curiosity. It's like, well, what is MS? What is RA? I mean, we can give them descriptions, but what really underlies it? And I think Dr. Zwicky this morning kind of hit it on the head. It's molecular mimicry. And if you go into PubMed and you type in molecular mimicry and any condition, MS, Lou Gehrig's, whatever, you'll be surprised at how much literature there is out there on the different microbes that are associated with these conditions. So this isn't fringe medicine. I mean, this is pretty well established. And but I'm always surprised when I throw it back at another doctor. I'm like, hey, did you read this article on, Klebsiella and rheumatoid arthritis? Nope, never heard of it. Oh, that's funny because there's only about 100 studies on it, but I'm just a naturopath, so what do I know? So, all these different things, mono, polymyalgia rheumatica, Reiter's, RA, lupus, any autoimmune problem. Again, when you start hearing about these chronic inflammatory conditions, it at least should be on your radar to rule Lyme and some of these co-infections out as a possible trigger. So some of the other co-infections, we always talk about Lyme kind of being Lyme. It's hard to talk about Lyme without talking about all the other things that could be transmitted through a tick bite. Again, this is a partial list. Every year I go to a Lyme conference, this list gets longer and longer, the number of things we know can be transmitted through a tick bite. But the ones that are probably more common, Babesia, which is a cousin of malaria, it's a blood parasite. Bartonella primarily causes cat scratch fever, but obviously you can get it through tick bite, not just the cat. Anaplasma, which used to be an Ehrlichia, it got reclassified. Ehrlichia, Mycoplasma, which typically causes walking pneumonia, but again, you can get it through a tick bite. Rickettsia, which causes Rocky Mountain spot and fever. Powassan virus, this is one that made the news this year, at least in the US. We had several deaths due to Powassan virus. And the problem with Powassan virus is, of course, A, it's a virus, and B, it was a very rapid onset illness. So people who got it got sick very quickly and died very quickly. And of course, even if you gave them antibiotics, it would do nothing because it's a virus. So we got some scary things coming down the pipe with these tick-borne illnesses. Colorado tick fever, Heartland virus, tularemia. I mean, there's many, many others. So I think it's a good idea when you're bored, start going through and just familiarize yourself with all the different things you can get through a tick bite. Because as you're doing your evaluation, you want to try and cast as wide a net as possible as to what might be, underlying the illness. So around the world, I mean, we're seeing an increase, not just in Lyme, but really all of these, vector-borne illnesses. We've seen an increase in dengue virus in South America. We had this little thing called Ebola virus a few years back in Africa. Chikungunya virus down in Central and South America, which is now starting to spread to North America. And, ticks, fleas, mosquitoes, flies, snails, all these things can transmit these illnesses. So Dr. Zwicky also mentioned this morning, why is this happening? Well, the World Health Organization actually published a paper on this, and I gave you the link down there below if you want to read it. It's pretty interesting. This is a lot of words on a slide. The Cliff Notes version is basically, we're warmer. The things that naturally kill ticks are no longer killing ticks. And the temperature actually affects how the tick replicates or interacts on its host, be it the rodent or the deer. So these warmer climates are actually basically going to allow it to thrive better and longer. Plus, we also have a lot more water out there, and more for mosquitoes. Mosquitoes need water to breed, but the general trend with this overall warmer temperature is the things that would normally get rid of ticks aren't. And Dr. Zwicky also mentioned we now have things bringing humans and ticks closer together. So the more we share that environment, the greater likelihood we are of getting these different tick-borne illnesses. So I'm sure Noah on the ark, if you believe in that, probably didn't have ticks. Maybe he did. We don't know. So let's talk about Lyme diagnosis. And if you haven't already noticed, it's extremely controversial. The reality is it shouldn't be, and I'll explain why. The CDC criteria for diagnosing Lyme was never, ever designed to be diagnostic. I should say the test we used was never designed to be diagnostic. It was used as a surveillance tool. They took people that had known Lyme disease, they had all the classic symptoms, they drew their blood, they looked to see what antibodies are there. They're like, great. Now we have a way that we can monitor people over their course of treatment with the anticipation that antibody levels would drop. The disappointing thing is that the research is showing is that antibody levels actually don't drop very well, and that even with proper treatment, it can take 20 years for antibody levels to drop. So if you're using antibodies as a marker to monitor your treatment, forget it. You're not going to see them drop to what you think. Or if you see them change, it won't necessarily correlate with what you're seeing in front of you. So it's not to say that antibody levels won't drop. In some cases, they will. But I've done this long enough to see that it doesn't necessarily correlate with how people feel. And at the end of the day, you're treating the person in front of you, not what's on a piece of paper. So Lyme disease itself really is a clinical diagnosis. And I mentioned, all the different strains out there. The current testing method, the two-tier, CDC method, is only looking at Borrelia burgdorferi. Now, some of the other labs, some being represented here, are actually now looking at other strains of Borrelia. So our technology is starting to improve. We're starting to widen the scope a little bit. We know out on the west coast of the United States that half of the cases are Borrelia miyamotoi. They're not Borrelia burgdorferi. I have several patients I treat who are Australian. The Australian government says, nope, there's no Lyme here. We've tested all the ticks. I said, really? You tested all the ticks? That's a lot of them. But apparently they did, and they didn't find Borrelia burgdorferi. Well, let me see. The type of Borrelia in Asia is different. The type of Borrelia in Europe is different. So wouldn't it make sense that the type of Borrelia in Australia could be different too? So maybe we're just looking for the wrong thing, or we being them looking for the wrong thing. And more than likely, that's probably the case. So I'm hoping what will happen as testing evolves is that we'll start finding things that are common to all Borrelia. In fact, there's a new lab in the United States just last year. They're now doing an antibody test that found a sequence that's common to all Borrelia. And I think this has a greater chance of trying to pick up whether someone truly has a Borrelia infection.